Are teens depressed or just moody? This sounds like a hormonal moment, Dr. Hotze.
Well, having been the father of 5 daughters,
Bless you.
is that enough? Okay. So,
well, I got one son, and he's moody right now.
And we had 3 sons too, so that's 8. So when kids go through, when they have puberty, they're going to have some changes, okay? And they begin to act strange, and they can have outbursts of anger and all that. So there's a hormonal component in children as they develop, which oftentimes is addressed, unfortunately, by pediatricians or by OB-GYN by simply giving them antidepressants, which doesn't treat the underlying problem. It's a toxin, which is really dangerous to give to kids. As a matter of fact, in Europe, in the UK, they don't even allow antidepressants to be given to anybody 18 or younger.
But hold on, let me interrupt him for a second, because I'm going to disagree with you. Because I know there are specific instances where it's not hormonal, kids are depressed, and that does need to be handled, possibly
suicide
with
is the
some.
second leading cause of death.
Okay, let's talk about that.
15 right now.
Nobody has depression because they have low levels of antidepressants. They're knockoff to cocaine. They're dangerous. They have severe withdrawal. They dramatically increase your suicide rate by 6 times when you take them.
Where you're going is that if you have
is,
such low levels of hormones that's causing depression, that you replace it with hormones.
The first thing you want to look for is a natural problem.
Right.
So the most natural thing is they got hormonal changes that can be addressed. That's the first thing you do.
Yeah.
Second thing, you can be, believe it or not, you can have allergies in foods and other problems, other illnesses that can be addressed.
But there is a small percentage that actually have depression. I know from personal reasons. So I'm going to disagree with you, and you do have to address that.
Yeah, he's saying do the forensics.
Yes, I agree with
sit there
you.
and say
Exactly.
why. Just ask the first question. The first thing to do is not to medicate. The first thing to do is to figure out
right
why.
now they over-medicate on that. The problem is not they don't under-medicate. For any problem, they give the antidepressant, and it's dangerous.
Start with why that child is depressed and figure that out first, and then address that issue.
Cyberbullying, and that's what we see.
That was a
we
good
see
point.
Which is kind of a new thing.
Yes. That wasn't an issue when we were teenagers, and I do believe that because of the way kids can and do interact with each other, and Lord knows how many people that they don't even know through the internet, we are now starting to see a lot more symptoms of depression, whether it's a medical cause or a psychological cause needs to be teased out. I think the most important thing is to talk to your teen, make sure that you're engaged with that teen, and if you start to notice things like irritability, like lack of sleep, like they're going through their puberty, get in touch with them, make sure that that's the normal process and that you're helping work.
And even therapy can be great. Just like, honey, I want you to do a little checkup, go to the therapist, tell them everything you need to tell them, and then that way, you can, a third party, non-judgmental, and the whole bit.
Also, kids that are on ADD medicine, they also can get depressed. And that's one of the signs. Parents really need to pay attention to that as well.
They really can, yes.
All right, I'm going to touch on this one.
That's a really good point.
Yeah.
I'm glad you like that one.
She's okay. She's okay. Sometimes.
We're just going to wrap it up right there then. How about that? Okay. And by the way, you're a plastic surgeon. You can take care of all our depression issues, right? Okay.